Hello, ladies. Welcome to my channel. This is Irva, and today I have a special guest with us, Jonelle Samuel. She's a gynecologist, and today we're going to just ask her some questions, all the pertinent things that you wanted to know, the questions that you sent in. So thank you to the viewers who sent in some questions in advance to ask her. This is your chance, so we're going to meet your gynecologist. So Jonelle, tell us about yourself a little bit.
Hi, yeah. So my name is Dr. Jonelle Samuel. I'm an obstetrician and gynecologist. So that means that I deal with women throughout the reproductive lifespan. So women when they're pregnant, having babies, before they get pregnant, issues with the menstrual periods, women as they transition from having periods to menopause, women who are menopausal. So I deal with the whole gamut.
Okay. And yes, I did not say Dr. Jonelle, and my apologies. Yes, this is
Okay.
Dr. Jonelle, the gynecologist. So I really want to apologize about that.
Okay.
So I'm just going to ask you a few personal things versus gynecology. Growing up as a young girl, you're still quite young, but was that something that was always present in you? I know one of my guests, she said at 8, she wanted to be a pediatrician. Was that kind of your path?
So for me, I didn't always want to be an OBGYN. I actually loved kids. At one point, I was thinking about pediatrics. At one point, I was thinking about, working with the heart, so a cardiologist. It wasn't more so until I went to medical school and started doing my clinicals and started doing research and just growing up as a young lady and as a woman and dealing with women's problems that actually became interesting to me.
Okay, so thank you for that. And you talked about dealing with women's problems. So tell us a little. I know some of the questions our viewers sent in. One of the questions were, how do women ensure that their ovaries are healthy? So can you just tell us a little bit about that?
Yeah, so good question. So I'll say one of the first things is more so just being in tune with your body and knowing what is normal and what is abnormal. So one of those aspects would be your menstrual cycle. So are you having periods normally? So are they occurring between every 21 to 35 days? Are your periods lasting more than 7 days? That's a little bit too long. Are your periods very heavy? Are you having clots with your periods? Are you having a lot of pain with your periods? Also too, making sure that you maintain a healthy lifestyle. So lifestyle means eating habits, you're eating correctly, you're eating healthy, not too much processed foods, not too much sugar, that you're exercising at least 3 times a week for at least 30 minutes a day.
Oh, wow.
If you smoke, don't smoke. So this is in regards to particularly nicotine. So cigarettes, that increases risk for ovarian cancer. Trying to avoid toxins in the environment. So I think there was something out about Johnson and Johnson products with the baby powder, so talcum,
Mhm.
how that can be associated with risk for ovarian cancer.
Oh, wow.
So those are, yeah.
That is
So
new.
kind of
I
just
did not
being,
know that. And that's, I
yes.
mean, I'm from the Caribbean. That's a very common product that we use on our kids. I probably used it
Hmm.
here on my kids. So that's, wow, I was not aware of that at all.
Exactly. Yeah. So all of those things, just more so trying to be as healthy as you can.
And you know what, though? And you made a really good point. It's so simple. Just be healthy, try not to eat a lot of processed foods, exercise, just basic things that we should be doing every day. And
Right.
and it's funny that those are some of the things that could prevent us from getting ovarian cysts and those sort of stuff. So thank you very much for that. So ladies, you hear it's really not hard to start a healthy lifestyle. Just stop eating the junk. Let's go outside. Spring's coming. Let's get active,
Yes.
right? And I've been following some of your posts. I see you are quite active. You've been going outside a lot, and stayed taking all your little hikes and stuff. So you're leading by example. So thank you. um, Another question that we had is tips from teenagers to adulthood to keep ovaries free from developing polycystic ovaries. So I'm guessing that's kind of similar to.
Yes. So similar. So polycystic ovaries, I believe the reader was referring to a condition called PCOS, also polycystic ovarian syndrome. So it's
Mhm.
actually one of the most common hormonal problems in young women who are still having their periods. That's when you have an imbalance in your period. So you can have irregular periods, you can have heavy periods, have issues with acne, abnormal growth of hair on your face or on your chest. So people who have to actually, shave and pluck hairs, that could be a sign of something else that's going on. And
Mm.
also too, what people don't know, PCOS can increase your risk for fertility issues. It can increase your risk for metabolic syndrome, which essentially means increase your risk for diabetes and heart disease. So kind of in line with what I mentioned before, just kind of staying as healthy as you can will help to reduce that risk. And also, keeping a normal weight for you will help you to decrease that risk.
Wow. So it comes back again. If we healthy, it's the general rule. Eat healthy, stay active, stay healthy can help prevent some of those things. Um, Another question we had, well, a point. So if you can elaborate on that, fibroids are the number one thing that bothers a lot of Black women and Caribbean women. So can you elaborate on that and shed some light for us?
Yeah, so fibroids, so they're benign, so non-cancerous growths or tumors in the uterus. So they can grow in the uterine muscle itself. They can grow inside the womb, so where baby grows. They can grow on the outside of the womb. And a lot of times women can have fibroids. You may never even know you have fibroids. It might just
Mhm.
be there. Sometimes, you might, if you're noticing that you're having issues with your cycles or heavy bleeding periods, you go and get checked out with your gynecologist, have an ultrasound, and you'll see that they find something called fibroids. And so the issue with that is depending on the size, depending on the number, depending on where it's located, it can cause issues with bleeding, heavy bleeding, pain, so pelvic pain, even low back pain. It can press on your bladder. So some women might go to the bladder go to the bathroom, sorry, very
Mhm.
frequently.
Mhm.
And it can really just mess up a woman's quality of life, to be honest. And
Wow.
so I think a lot of Black women unnecessarily deal with fibroids, for years without getting treatment for it or without seeking an opinion about it. And just, it's something that you don't have to do.
So you
So, and
said,
it's very prevalent.
sorry, that it's something you don't have to do. So you discover you had a fibroid. What's the next step?
So the next step would be to see your OBGYN.
Okay. Is it,
Yeah.
does every fibroid lead to surgery, or some's controlled by medication, or some would never grow?
Yeah, so fibroids, they do grow. There can be certain reasons why they grow. So people who are a little overweight or obese can increase with that. Certain tumors, certain hormones can increase that growth. Depending on how big the fibroids are, their size, and then whether they're causing issues or not. So if you have fibroids and they're not causing you any issues, let's say they're small, your physician might say, you know what, we'll just continue to monitor them for some time. So you
Oh,
might monitor them yearly, a couple times a year, and not do anything. If they're
mhm,
causing you issues, then you might look at medical management. So that's like hormones. It's like a
mhm,
birth control pill. It could be like an IUD, like something that would help your symptoms of heavy bleeding.
mhm,
Um, More so for women who have like the problems with like the back pain, the going to the bathroom very frequently or feeling very bloated. If their fibroids are big, it's actually probably more so recommended to remove the fibroids because it's due to the size and weight of the fibroids that's causing those issues. Um,
wow.
Mhm. And then some people think that having fibroids means hysterectomy, and it doesn't. Like, back in the day,
Okay.
they used to take out, every woman's uterus. If you had a fibroid, your uterus
Yeah.
just came out.
Yes.
Not anymore. We don't do that. So you don't have to have a hysterectomy just because you have fibroids. So there's
Okay.
different surgical options too to
Mhm.
treat fibroids without having to remove the entire uterus.
Perfect. And for me, I know just talking to a lot of women, most women, it seems that they sort of know about it during pregnancy, or, they got pregnant and then they heard they had a fibroid. Is that kind of, I'm assuming it doesn't always bother you. So is there something to do with having been pregnant? Is it the hormones that would make them grow or make them prevalent or noticeable?
So yeah, the hormones can make them grow, but I think more so probably the reasons why it's more so noticed in pregnancies because women seek care when they're pregnant. So when you get pregnant, you have ultrasounds, and then that's when it's noted. So I
Yes.
think that's the reason why it may seem more prevalent when women are pregnant is because they're actually being seen at that time.
Mm. So I guess you just made a good point. Maybe we should stay on top of our checkups, right? Because
Hmm.
there's so many things that we don't know is happening until we get pregnant. So
Yes.
I can speak to that myself also. So thank you for that point there. Um, you mentioned a few things, and it's so funny because I'm hearing you saying over and over a healthy lifestyle. And in general, we think of, well, my opinion though, you see people working out, we go the extreme, like, oh my God, she's always working out. Oh, she always want to be healthy or fit. But there's so many pros to just being healthy.
Yes, yeah. And also too, even though I'm mentioning, lifestyle management a lot, there are some other factors that we can't change. So,
Mhm.
lifestyle we can change. We know even with fibroids, sometimes they can just run in families. So particularly for Black women, your sister may have had them, your mom may have had them, your
Mhm.
mom's mom or aunt may have had them. So that increases your risk for having them too, because there may be also a genetic component for them as well.
Mhm. Okay, so that leads me now to we gotta because this is about women empowerment. And I want to touch on the infertility topic that a lot of women don't want to talk about. So does our lifestyle, and it kind of sounds so now at this point as I'm listening to you that lifestyle could affect, us being fertile or infertile. And I also want you to just touch on how does that disempower women, if you can share some light and just your opinion on this. So first, does a lifestyle impact women? Does women's lifestyle impact them being fertile or infertile? And how do you think, in your
So
opinion?
yeah, yeah. So lifestyle can impact it, and then there are other, aspects or other factors that have nothing to do with lifestyle. I'll start with saying, in terms of what is infertility. So infertility is when a woman is unable to get pregnant. So for women who are under the age of 35, because in the OBGYN world, if you're over 35, you're considered old. So for women who are under the age of 35, if you've been trying to get pregnant and it's been at least 12 months or a year, and you haven't been able to get pregnant, you're considered to be infertile. If you are over the age of 35 and you've been trying for at least 6 months, then you're considered to be, having issues with fertility.
Ah,
Also, too, women who, let's say, have gotten pregnant, but for whatever reason they have recurrent miscarriages or they're unable to, bring a child to term, can also be considered to have, infertility issues as well. Just to put that out there. So there's so many factors, that go towards fertility. One factor I don't think that's touched on a lot is the fact that they're men, so it's two people, the
yes,
man and the woman. So man plays a part as well. So for
yes.
men, there's male factor infertility, so issues with their sperm.
Mhm.
So it's not, those sperm, if they're not swimming like they're supposed to, if there's something wrong with the shape of the sperm, or various other reasons for men, that can also lead to fertility issues.
Mhm.
Beyond that, so kind of with women, what we can do about it in terms of factors that we have power over. So your lifestyle, can affect your fertility.
Mhm.
So for women who are, if you're very sexually active in terms of having multiple partners, if you're not using protection, so that's condoms, and you have, a history of sexually transmitted infections, more so a history of a lot of infections, that can lead to infections that will cause blockage in the tubes, blockage inside the uterus or scarring or adhesions, and that can lead to infertility. So that's something called PID or pelvic inflammatory disease.
Mhm.
So I think that's, major to know. I know that there are some women who don't even realize that some of their choices,
Mhm.
throughout the formative years can affect their fertility going forward. So, blockage is one of the big factors. Another factor, fibroids, as I mentioned before,
Yes.
particularly the type of fibroids that grow inside the cavity of the womb can affect fertility. There's also, polyps. So
Mhm.
polyps are different from fibroids. They're kind of like an overgrowth of tissue inside the uterus. They can affect fertility. PCOS can affect fertility. There's also a disorder called endometriosis, where you
Yes.
have you have
So,
abnormal implants of tissue outside of the uterus.
so I'm gonna ask you a question here, sorry, because you mentioned things that we've done in our formative years. So let's say, what if people use protection and all this stuff? Could that still affect, or that kind of lessens the chances of you if you're having many partners, but it's protective?
So it lessens a chance, but it doesn't protect you. So, because condoms aren't 100%. That's if you're using the condom correctly, that's if the condom doesn't break. So there's so many factors there. So, if you're having sex, there's always that risk. In order to mitigate or decrease that risk, yes, condoms, are recommended.
Okay, okay. So the infertility issue though, because I know there's some women and there were you made some good points. First, I wanted to point to that sometimes it's the man. And I know coming from a Caribbean background, generally, it's a woman, right? Nobody considers anything else. Oh my
Mm.
goodness, she can't have kids, you know? But I know also medically, usually they would check the woman out first, but there sometimes it's the men, and we kind of accept that it's us, right? And some men from Caribbean background probably don't even want to get checked out to see if
Uh-huh.
it's them. That we just accept, and women accept that I'm infertile, I can't have kids. So thank you for pointing out too that it's not just women that causes the infertility issue. Sometimes it's male, because yes, if your sperm's not swimming, there's a problem. So for my male viewers out there, you can go check the urologist. You know, the women will start with the gynecologist here. So thanks for putting that out. I wanted to also ask though, because coming from a Caribbean background, I hear things like, people who were infertile years and years, they were trying, they went on vacation, they came back pregnant. And people said the change of the atmosphere or whatever. What changes? Years, they're not even trying now, and they got
Well,
pregnant.
sometimes honestly it's just the stress. So if you're focused on, trying to get pregnant, you're timing it, all of your focus and your energy, it's on getting pregnant. Sometimes when you just let go and just allow yourself to enjoy life and just, what else life has to offer, and you just enjoy it, it just happens. So sometimes that's just what nature does.
Oh, okay. So you're saying, yes, de-stress yourself, just let it go. That's why, I mean, sometimes it just happens. So it's nothing
Yes.
to do with a change of scenery. It's not, well, I guess sort of, maybe the stress factor, right? But it's not
Yes.
because the water is different and the air is
No.
clear or anything like that. Because I hear that a lot, oh, she went to Grenada and she come back, she's pregnant. And they
Hmm.
will try for 10 years. And now it's kind of believed, yeah, if you leave Canada and go the US and go to Grenada or St. Lucia or something, you may come back pregnant. But I'm glad that you say it's the stress factor sometimes. Because I know I did struggle at some point in my life with infertility. And I can tell you, ladies, and I'm putting myself out there, it is not fun. I didn't find it, the timing, the temperature, the going to the fertility clinic. I think I was getting shots or something. I can't even remember now. It was
Hmm.
to me, it was so mentally, it was like a psychologically try. Nothing was fun anymore. The relationship, it was taxing, you know, even copulation was an argument, 6 o'clock, we gotta. So it loses all its its flavor and
Exactly.
and still didn't get pregnant. And then one day, years after, I got pregnant. So, so I think you're right. When you give up the stress of even trying to get pregnant, um, as a
And you
person myself who was infertile at some point, the woman comes into the clinic and she's trying for years. From your opinion, does that impact women or empower or disempower women? Do you find that, if a woman can't produce a baby?
So for some women it can, and you touched on something pretty important in terms of even culturally as well. So for example, if you're from the Caribbean background, or maybe from an African background, different backgrounds, people look at fertility a little bit differently. I would just say in terms of amongst the Black community, we look at fertility
Mhm.
differently. So we are less likely to go to the doctor and actually seek help with fertility. We're less likely to talk to our friends or coworkers or somebody else and saying, hey, this is what I'm going through, and have like that support system, or maybe find out, hey, is there anybody else that's dealing with this like
Mhm.
I'm dealing with it? Because there's this, kind of, there's a shame that is associated with not being able to get pregnant. It kind of puts the onus on you, like, oh, there's something wrong with me. And so for women who feel as if there is something wrong with them, which there is not, but when you feel as if there's something wrong with you, then you can feel disempowered. And
Mhm.
especially if you put, if motherhood, which does not have to only be through, having a biological child, but if you put
Yes.
motherhood at that forefront and say, you know what, in order for me to feel like a woman, in order for me to feel empowered, in order for me to feel like I'm doing something in this world, I have to have a child. If that's all that that
Mhm.
you feel that you have going for you, then yes, it can disempower you. So I
Mhm.
think also too, just having different things in life that you're interested in, knowing that you are more than enough, that you're more than just your uterus, you're more than just what
Yes.
your uterus is capable of doing,
Yes.
and just being able to kind of talk about it. I think now, nowadays, I feel as if more of us are speaking more and more about
Yeah.
fertility in the African American community. But Traditionally it's something that was kept like hush hush.
Yes. And you made a few good points there. All of it was good. And I'll just bring up, I remember years ago, and I was working at this place, and this person couldn't get pregnant. And well, she was getting pregnant, but then she was miscarrying, and it was just really sad. But the point I wanted to make, I remember her saying, because she's of Caribbean background, and she said her mom said, "Oh my God, your husband's gonna leave you,
Hmm.
because you can't give him a baby." And she felt so broken because yes, in our community, and not so much now, thank God, I think we're kind of getting around that. But women, if that's all they had going for them, and that was always their childhood dream, to be married and have kids, and then they couldn't have kids, some women either accept that their husband would leave them, some women accept that their husband would have other relationships to have his kids, some women, well, I can't give him a child, so
Yeah.
because that's all we had going for us. You mentioned, though, there were other options of having children, which is another topic in itself, because I'm actually going to do something on that for Mother's Day, because in Caribbean, that's still a little bit taboo, the other ways of getting pregnant and having children and adopting and surrogacy and all the stuff like that. But I like the fact that you said about there's other things, just be your beautiful you. So
Yeah.
thank you for that. Anything else you want to share with us? Anything, you think women out there should know anything about fertility, sexuality?
So, with fertility, just knowing number one, that you're not alone. So, if you're going through fertility, know that you're not alone,
Mhm.
seek help, go speak to your obstetrician gynecologist. And also too, I think, one of the important reasons for having someone that looks like you. So, even seeking out a Black physician,
Mhm.
sometimes, may even feel a little bit more comfortable in terms of, explaining what you're going through, so that we can do a thorough history and physical examination and work up to see, okay, what possibly could be the problem. Knowing that I said, you are more than just that. There are other options. So as you touched on, some of these options, though, it's another topic.
It
It's pretty expensive. So in terms of in vitro fertilization, IVF, there is insemination that you can do. It's a little bit more cheaper. But some other things you can do, they can be pretty expensive sometimes. Depend on your insurance, they may not cover those
Yes.
services, so that's another issue too for some people. And adoption too also can be expensive as well, probably just as expensive.
Mhm.
um, but yeah.
So you know what, and you talk about the expense and stuff, which didn't cross my mind. And I do have some viewers in Grenada and Carriacou and stuff, and um, I'm speaking from living there years ago. It's not those options, in terms of getting those kind of services, are not really options
Mhm.
in those islands. So unless they travel, or some women just have to accept the fate that I can't have kids. And I remember growing up, you see some women carrying, it's like a burden for some women that they couldn't have kids. And there's so many other beautiful things that you can do in life and empower yourself and take the thought away, probably, or yes, adopt a child, or just grow up a child, or help a child, or sponsor a child, or something like that. So there's so many other things, women out there who's listening, that we can do if you can't have a child. And though Dr. Jonelle said, yes, for some of us, our dream, I remember growing up and I'm signing my name over and over with this guy I'm dating, and one day we're going to have this kids with this color. And I was doing our biology. I was genetically crossing what I think our kids would look like, and all this stuff like that. So yes, so I got married quite early, and then not to be able to get pregnant, that was quite, it's like, wow, I met the handsome man that I wanted, everything that I wanted. We had the house, the car, and I wasn't getting pregnant, 26, 27, 28, 29. It's like, what is going on here? But later on in life, you just let it go and you realize it might
Yeah.
happen, but there's other things in life that could happen to you that's good too.
Actually, and there's one other thing I wanted to mention too. So for women who are a little bit older, so if you're beyond the age of 30, particularly around 35 or over age 35, and you haven't had children yet, because you've seen that more and more as,
Mhm.
women are having higher levels of education. So, we're having children later and later on in life. The older you get, the eggs or the quality of the eggs start to diminish. And so our ovarian reserve, so that, fertility potential decreases, especially after age 35, it decreases every year. There is another option called, freezing your eggs. That some women actually do now as well. So that gives you the opportunity to, freeze your eggs as early as possible. So in your 30s, so that later on in life, you may not have to worry about, oh, I'm older, may have issues having a baby. So just want to kind of put that out there to say that that's an option. So you can speak to your physician about that, egg free.
I like that, because now more and more of us are getting into our careers and putting off having children. It's not like our parents when they had the kids. I think my mom got married like 18, right? So most people are into the careers and children are coming later and later. And so eggs are getting less and less viable. So thank you for putting that out there. I really like that idea, So ladies, you can pursue your career, you can chase your dreams. If you really want to have children later on, you can do it. Put your eggs aside, talk to your physician. So thank you so much. That's a good one. There's a lot of points you brought up, though, that really leads us to another topic that one day I'd love to have you back to discuss. And to my viewers out there, from this discussion, if you have any questions, please send it to me. I will definitely send it to Dr. Jonelle, and invite her back if she'd like to come. I really appreciate your time. I know you're
Thank you.
Thank you so much. Anything else you'd like to throw there in the last few minutes that's left?
Yep, nothing much more. If you have any questions, definitely don't hesitate to ask. I would love to come back on and answer any more questions or discuss any other topics that anybody wants to talk about.
Thank you so much. Well, I will be having a panel discussion around Mother's Day, which includes surrogacy and all the different kind of, in vitro, all the things, different kinds of parenthood, and I would love to have you on. I would also have a topic which would include single ladies and married women, just talking about COVID and sexuality at this point, COVID and love, COVID and dating, because I had some questions too. How do you date, to mask?
That's a good topic.
Mask, right? And it's not about STDs anymore, because this guy can be perfect or this girl can be perfect, but do you want to kiss them? Is week 5 good? Is week 20 good? Where are we at? So I'd love to have you back as that part of this part of that discussion. But thank you very much. Thank you for your time. Thank you for all the advice. Thank you for your medically sound information that you put out there. And ladies, as she said, there's other things to do that should not disempower you because you cannot have a baby. And there are other options, and including you can talk to your doctor about freezing your eggs and stuff for later on, or there are other methods of being a parent. So thank you very much, Dr. Jonelle. To all my viewers, please stay tuned. Remember to subscribe. Remember to like. Send a comment. You can email me at wedo7806@gmail.com. Thank you.